To everyone. Today is our town hall meeting where we are going to be talking, bringing the community together, and celebrating some of the achievements in 2024 from the TBPPM Learning Network. I'm looking forward to seeing many of your faces, and it's great that several of you have already turned your camera on. Today's agenda heavily focuses on the work in the country chapters, and we're very pleased to be able to have the consultants that did a humongous amount of work on the evaluation present, and both the country chapters will be talking about their work as well. And then we have several other people that work actively in a variety of other countries that we're hearing from. So it's an exciting agenda. Many of our key people are busy around the world, and it is a very busy time. So on behalf of people in the PPM working group, such as the chairs, Shri and Mohammed, they both had to decline. Madhu is not able to join. Monica is not able to join. So many of our people are, I know it's a very busy time. So we're still going to go ahead because we want to round off our year as well. And in spirit, we will send good thoughts to everyone who's busy with many other things. And we know that the network is much larger than what we see on the screen right now. So if you get a chance to tune in later on this recording, we're very happy that you are with us and that you're part of the Learning Network. And thank you for all the work that you do. Hi everyone who's just joining. Thank you so much for tuning in. We are just kicking off our meeting, and anyone who joins in later, please welcome. Put your camera on if you want to. Use the chat if you have anything that you would like to say while others are speaking, and keep yourself muted. And please raise your hands. And this is an interactive opportunity to bring forward your thoughts. And so welcome everyone. Really looking forward to having everyone around the table. And so maybe to kick us off, I would love to give a short, brief presentation and I'll try to really keep it brief. It's hard for me because I'm so passionate about this area and this work that we do. But I'll try to put a brief presentation together while I'm looking for my screen and I can't find it. I have too many tabs open, I guess. Okay, let me have a look if it pops up now. Sorry about that. Here we go. So to set us off and just bring everyone on one page in what we're doing in the Learning Network, I think can you all see my screen now? Yes? Okay, perfect. So we're here at the virtual town hall meeting. It would be so much more fun to be in person, but it is virtual, and we're really pleased that we can do it virtual. So thank you all for joining. The agenda of today really is to go over, the objective is to bring everyone together and to have a platform to share opinions and feedback on progress and plans, and discuss joint areas of interest for 2025. I'll be going through a short introduction, then we'll focus on the country chapters, and then have an open floor for several TBPPM members to present their activities, and we'll do some input from everyone also on our electronic platform. And I'm very pleased to have many of you collaborate and join in. And we have some end of the year celebrations for 2024 with our most active members. And we're launching the photo contest that leads us toward World TB Day. So it's a full agenda, and very pleased to kick it off. So just to set the scene, and I know you're all very familiar, so I won't spend a lot of time, but making sure that you are all aware of the details and you can look up more. So I'll fly through some slides. And pause me if there's anything that you would like to know more of. So we all know that the data from the WHO report show that tuberculosis is back at the top surpassing again the COVID-19. 10.8 million people fell ill with TB in 2023, and one big gap is the funding. The funding comes up, we're not receiving that. However, the good news is that we are narrowing the gap between those people that we're estimating have tuberculosis and those that actually are being reported and recorded. So we are closing the gap. And I think we can celebrate that the engagement of private providers has a lot to do with that. So as we know from our PPM dashboard, which is a big effort that WHO has put together with funding from the Gates Foundation, this year, we launched formally the PPM dashboards, and there is a policy brief that I'm happy to put in the chat for you all, and I'll put some other links in the chat when I'm not talking anymore. So the policy brief outlines how the PPM dashboards are an opportunity. Right now, there are the 7 largest countries that have data on private sector engagement, and as you can see in the images, this is where we track the public and the public-private mix, and these are in line with the WHO surveillance and guidance and benchmarks and indicators. And right now, these are focusing on 7 high-burden countries, but there are plans for in the future to roll out the PPM roadmap and the dashboard in line with national plans, and so that is on the agenda for the future, for 2025. The data that we have also gives us a really good opportunity to see which private providers and private facilities are engaged. And this is a snapshot of the WHO recommended diagnostics and how they are distributed in various countries. And you can see the red areas and the green areas is where it is available in where it is available at the primary care or the secondary tertiary care level. And you can see the gaps. And this graph is all available in the WHO data, and it shows us that right now not many of the tools are actually available in private settings. So this is an area for us to continue to be working on. And from there, I want to just say, what is the role of the TBPPM Learning Network? So our role is we're really bringing a community together for South-to-South learning, peer-to-peer exchange, and to together push a much broader expansion that goes beyond the public sector. And through that, we have a circle of knowledge, how we pull learning in from the countries, that's the experts, and we do several knowledge products, provide learning, and then push information out, and then prioritize it. So we have a certain set of values that you're all very familiar with: people-centered, implementer-led, and adaptive leadership, knowledge-driven. Our roles, I'm not going to go through this because you're all very familiar with this, so I won't spend a lot of time, but there are a variety of roles, from convening to connecting to really clarifying and capacity building. So this is our work plan, and I just want to say that we've been really fortunate and thankful to the Bill and Melinda Gates Foundation for kicking this off in 2019 when we were officially launched. So that is now over 5 years ago, and we got a second grant from 2022 until June 2025. That's where we are in right now. So we're in the last part of our current grant, and the knowledge system that you saw earlier is the type of work that is part of the grant. So the milestones in that grant are the amount of webinars, the amount of knowledge products, the different articles, and the course. That's all part of our current grant. And that's laid out. This is just a snapshot, and we have a much further detailed outcome. So what have we achieved in 2024? And it was so nice to see many of you live in Bali, because even though we're online and it works as an online network, we've grown as a really vibrant community with now 4,300 members. And I'll show you a little bit more on the breakdown. We have strong communities at country level that are definitely in Nigeria and India have been closely tied with the Learning Network. There are many other communities in other countries that we're excited to collaborate with. And we have an online active platform with many different products. Then we empower champions And I'm pleased to say that we had a really good course this year again, where we can actively do the monitoring of the data. And then in general, we know that the Learning Network has a positive ecosystem that we connect with in the larger TB world. So about our reach. So just to give you this snapshot, where we say we have 4,345 members by the end of 2024, but our reach is much wider through our mailing list, and then obviously all the social media platforms that I haven't even covered in here. And we've further broken it down in who is really engaged, who is really active, who are the PPM champions, and who are the PPM leaders. And that gives us a really good idea of where the community is. And in a normal, when we compare with other communities of practice, about 10% of the people are active. And in our case, we're proud to say that we definitely have that 10% active in our community. So here's a quick snapshot on webinars and Friday forums, what we did in 2022, 12 webinars, 5 forums, and you can see at the bottom, these are the graphs where we do a breakdown of what type of speakers, nearly 100 speakers, mostly from the South. About half technical and half implementers. Women and men are almost evenly distributed, with a few more women speaking in our last year. So we're having a good variety of people on our platform, and really, really proud and working hard to keep that diversity going. Our course, and again, I won't go into the details here because many of you are familiar with the PPM course that we host at the McGill Summer Institute, but there's a lot of good information that drives our community forward. And all of this will be further detailed out in our annual report, and happy to talk if there's any questions. But just for those that are not aware, we'll do a course. And then the highlight of today's meeting, we'll talk about the country chapters. And I just want to say that this is where you can see everything coming together. It's not just the reach or the engagement through webinars, it's also the learning, and it is the leading of activities on PPM at country level. So I'm looking forward to hearing about the country chapter evaluation, which was a big highlight for 2024, and some of the work at the country chapters. And on the side, you see that there are several other countries interested and working collaboratively, actively working on PPM, and we've put those up there as logos, even though some of them are not actively working with that logo, but some are. And we're looking forward to hearing from Aditya from Indonesia as well on some of the work they do on PPM. And so looking ahead, and again, I wish we had a much more time, but would look really here is more of a question. This is our quick analysis. The world is rapidly changing. There's lots of challenges, whether we're talking about climate change, economic situations, massive shifts in geopolitical world that's happening. All of that has influence on how we as a network collaborate. And looking specifically at tuberculosis, there are some challenges within our ecosystem where we continue to fight for the equitable access to quality TB screening, specifically when we talk about those providers that don't have access to it. We've in the PPM space focused a lot on notifications and not necessarily on the care, and that is an area where we need to continue to improve. And I would say, as a last point, the TB focus is still very much biomedical and not social or on health systems, and that is a huge piece where PPM has a lot to offer as a public-private mix project. Most of them are project, but not sustainably funded or integrated in the primary healthcare system. So that whole area, those are challenges that we can look at. And there's hope. And I look forward really to hearing what you see as the major gaps or challenges that carve out our work and the work in PPM that you do. And within that context, we are currently looking at what the role of the TBPPM Learning Network is. As you all know, the grant is finishing by June. Whereas right now we have focused on that role of a connector and a communicator and the innovator as in the center, as you see in the center of this image. There are various needs that we have heard from our community members and from countries that really lead us more into advocacy, or that lead us more into knowledge management, into the area of market development, or into the area of capacity building, where tools are required, where people are really wanting more background. So in our quest towards expanding and extending towards extending our work, we are looking forward to work with the coalition of TBPPM members in the beginning of next year to define what that looks like. What could the next phase of the Learning Network look like, and what would priorities be that we can raise funds for? And so that is where, for 2025, looking quickly ahead, our grant will end by June. And then we are bringing a group of coalition partners together in January to set out a track of a transition year. We are hoping to really put a new framework together and transition the Learning Network into possibly a different host organization, possibly a different, and definitely with a different framework. So that is work that is starting to happen in 2025. And your input and your thoughts on any of this is very, very welcome. So what we're looking at, it's not the time to sunset the TBPPM learning, even though we proposed this in the recent PPM working group. There's a lot of still support. People see that there is a continued demand and a need, and what that focus should be and how we will, as Learning Network, evolve is something that we would like to do together with you. So I want to say thank you for a fantastic year to all the TBPPM members and all the partners, the whole team, everyone who has worked in the background. And if we're ready to do so, let's next year take our community to a next level together. So with that, I will stop sharing and hope that I'm keeping a little bit on time. And I would really love to now introduce talk about our country chapters. So as you all know, we focused this year heavily on an evaluation. So the first, I would love to ask Anaga and Sapna to give a brief presentation on the evaluation.
Sure. Petra, is my screen visible?
Yes, it's beautiful.
Super. All right, thank you. Anaga, over to you.
Thanks, Petra. So I'm going to be very brief. Sapna and I will share some of the high-level insights that we had from the evaluation. Please stop us if you would like us to go into any details, and we're happy to take questions thereafter. So as Petra mentioned, Sapna, can you go to the next slide, please? The TBPPM Global Learning Network came into being in 2019, and the year 2021 and the year 2022 saw the establishment of India and Nigeria country chapters. The idea of this evaluation was really to trace some of this trajectory and document what have been some of the milestones in the growth and development of both these country chapters for India and Nigeria, to draw some of the lessons, to look at what have been the challenges, the contributions, and to synthesize these so that we can deepen our understanding of how learning networks, especially at a country level, can advance the TBPPN agenda. The idea was really to use India and Nigeria as examples, of course, understanding that each of them come with their own context, in terms of political economy, in terms of TB burden, the health system response, but really to see if we could distill some common elements from the two national networks and look at what could be a pathway and building blocks for newer countries which we want to set up such either learning networks or communities of practice or knowledge sharing, peer-to-review, peer experiences at their level. Sapna, can you just go? I'm not going to get into the details, but just to say in one word that we did primarily the evaluation drew on qualitative interviews with a variety of stakeholders. We spoke to about 20 people. We also did an extensive document review of all the documents available, both with the global team as well as the respective country teams. And we did attempt to do also an online survey, which was open to India and Nigeria members, and to quantify some of the outputs over the last 2 to 3 years that both the country chapters have been in existence. What we've tried to do is to present this analysis using a community of practice framework, which is a Wenger's framework, which talks about domain, practice, and community. But when we looked at the two country chapters, India and Nigeria, we saw that they had followed certain building blocks, which is you see in this picture, 8 of them. We have presented our analysis in the report around these building blocks. And then we also go back and use these building blocks to give recommendations to newer countries who want to or who are already doing this work on what are the different elements that they need to look at for establishing such community of practice in their respective countries. Sapna, next one, please. So this is just a very snapshot summary, very, very high level summary of a comparison of the India and Nigeria chapters. I'm just going to highlight a few of them very quickly. So as I said, both of them have some foundational elements are similar. Some of the objectives are similar, but given each of the country context and the interest of the stakeholders, community members, they have naturally evolved in different ways. So both of them came into being, as I already said, in 21 and 22 after an extensive landscaping exercise. The scope and purpose more or less is the same, which is to look at supporting PPM knowledge sharing networking. And in India, there's now also newer elements being added like capacity building. In terms of the members, while there is a larger group which is on the mailing list, in terms of active engagement of members, there are about 700 odd members in the India country chapter, and we have about 200 members in the Nigeria chapter. There are, of course, differences between the PPM ecosystem and stakeholders. India has a fairly larger gamut of PPM stakeholders and also a government supported domestically financed program which is very front and center as compared to Nigeria, which still does rely to a great extent on donor grants and where Global Fund and USAID are some of the main players. The role of the country chapters has been a bit different in both. In India, it has been mainly as a convener and a capacity builder. Whereas in Nigeria, it has been more as a connector and getting the community together more on how to foster shared values and peer-to-peer connections. The NTP, the engagement of the national TB program managers has differed in both the countries. In India, the country chapter is more external to the national program and plays a more supportive role, whereas in Nigeria, it is very strongly embedded within the NTP PPM steering committee. And that also lays out how the governance works in both scenarios. In India, with an independent governing system, which is there with a more formal governance arrangements with a chair and a board, whereas in Nigeria, it still is far more flexible and leverages the NTP structure. The focus in both has been, in India has largely been on the intermediaries, and that's been one of the biggest contributions of the country chapter to create that space for intermediaries and NGOs as important players in the PPM space. Whereas in Nigeria, it's far more diverse and also includes engagement with the public sector. The core activities in both have been more or less the same, which has been mainly around knowledge sharing, learning, and capacity building. Some challenges for both countries which are common is the limited country level data and monitoring framework. While the global piece of monitoring and evaluation has evolved as organically the learning network has grown, we don't have a commensurate adequate information at the country level. Also, in terms of funding streams, while both are supported by the global network, we're also seeing independent fundraising efforts underway in both countries. Sapna, can you quickly go to the next one? This is just a snapshot. We won't go into the details, but what we've tried to also do is to just present what have been the milestones, both for the India chapter and also for the Nigeria chapter. Over to you, Sapna, for the next part. Over.
Thanks, Anaga.
Just try and move. What we did with the framework that Anaga showed was sort of chart out the journey that both the country chapters sort of took from their inception from 21 and 22. And in addition to that, we used the SWOT framework, the strengths, weaknesses, opportunities, and threats framework, to try and understand what actually supplemented, enhanced, or worked in the context of these countries, and how the PPM Learning Network plugged in, what were they able to achieve. And we also looked at what didn't happen the way they planned, what were some of the challenges that they had faced. Sorry. And what we then did was we clubbed it as what worked and what didn't work. I'm not going to read out the whole all the points that we have mentioned here, because we will be or Petra will be sharing the slide deck and the report with you. But we just wanted to highlight some very, very important things that worked in favor of the TBPPM learning networks in both these countries. Their birth and their inception in these two country settings happened at a time when both their NTPs had started building some sort of interest in the PPM work. So either through domestic funding or in policy conversation, or at least the recognition that private sector engagement is going to be a huge part of their NSP. What was another win for both our learning networks is that they understood the nuances of their particular context and sort of built the design and model of the learning network based on the local context. So just to give you an example, in India, to give you a very clear idea, and for those of you who know the Indian context, there are many players, many donors. The government themselves has their own funding and a lot of work, WHO, etc. So in such a setting, the space or the sensible decision was to play a supplementary, complementary, and supportive role to the government, because staying outside helped the learning network maintain a degree of objectivity. In Nigeria, just given the NTP structure and just the way policies are built, it made sense for the learning network to be embedded within the PPM steering committee. So similar to this, both the learning chapters took such similar steps, just not in their modeling, but also in the way they eventually started curating their knowledge products and their offerings to their members and audiences. One extremely positive point that worked again in favor of both the networks is that everyone we spoke to highly complimented the fact that the learning network had provided this neutral platform for a lot of experts, both within the country and globally, to come and exchange exchange experiences from their setups, as well as challenges. So it wasn't just everyone touting their success stories, but also very, very practical implementation lessons. In India, as part of this entire sustainability conversation, they've also transitioned into a secretariat, probably one of its very first kinds in the health sector, where a particular donor fund model has actually moved into a domestic setup. And though it's just been a year, or slightly, maybe actually just a year since they transitioned to the secretariat, they've really caught up to speed, and they've done a lot of activities and a lot of recce on what could be possibly the next step. And we sort of realized this in the conversation with the country managers of both the chapters, that they were envisioning how the next phase could look like. At least there were ideas that they had started throwing around with their NTP and the members in their countries. What needs to be improved? So yes, like Petra had mentioned in her first slide, that we have more than 4,000 odd members in the entire network. India has more than 700, Nigeria more than 200. But are these numbers actually translating into meaningful participation? That is a bit of a question. So people sign up, but do they actually come in for all these webinars? How much are they contributing? How much are they taking away? This remains a little bit of a gray zone. And we were not able to extract very clearly from a lot of the members on what they saw as necessarily the most valuable pieces. And that was a little concerning for us, but we also feel both the country managers as well as the global network is aware of the challenges, and they are sort of figuring out what are options to sort of engage with their members going forward. Another challenge, and while virtually we were all sitting here and we're all connecting today, and it's brought us all together, people did talk about the Zoom fatigue syndrome, because all of us are in and out of Zoom and online meetings every day, and they really wanted a sort of more of a balance and a setup where there were physical in-person meetings where they could exchange their lessons. Yes, the TB Union Network or the TB Union Conference is one network, but we're talking about how country members, as well as a lot of stakeholders in the country, said in the country there should be a PPM platform where all of us can get together and read and see the faces of the names who are there in our virtual network. Another complexity that we found is that while there are a lot of input and process indicators that you could map out with respect to both the country chapters, just looking at the entire quantification from a long-term outcome perspective was certainly very challenging. Potential opportunities, like Petra said, very critical year, early next year, the transition thinking will set into thinking. So yes, we definitely need to think of who are other donors we can tap in, other financial sort of streams that could be used to leverage and mold country models. But in addition to that, what we really came to the conclusion was that the country chapters could also leapfrog into the next stage of becoming thought leaders and influencers. And in both countries, they were already halfway or even more there, but now they could perhaps be the PPM leads in their country instead of just being knowledge sharers and conveners. There is a huge opportunity that Anaga and I saw, and again from these conversations with multiple people, on just not educating and conversing and building the capacity of private sector stakeholders, but also of our public sector staff within our NTPs, because unless we bridge the conversation between both these parties, the twain will never have a conversation, and we may not make the level of we may not reach the level of progress and achievements that we really hope to. We had certain recommendations for the country chapters along the lines of what we had distilled from what works, what didn't work, what are the areas of improvement and opportunities. Again, we've listed it down there. I'm not going to read it. And then the last sort of thing that Anaga and I put together is based on our framework. We've sort of laid out for countries like Pakistan, Bangladesh, Indonesia, Kenya, and any other country who may want to set up their own chapter on what is a possible pathway for them to build and operate and run and hopefully get into the sustaining of a network, a TBPPM learning network. Again, this pathway has been drawn out of the experiences of the India and the Nigeria chapters. We highly recognize that both these countries were at very different stages of their evolution, and our sort of last comment on this is that ultimately, while we can provide these pathways, it all depends on your particular country context and NTP's interest, maturity, and the private sector's interest to build this out. And on that note, I really want to thank Petra and the entire TBPPM team for just giving us the time to do this evaluation. Thank you so much.
Huge applause from me for both Anaga and Sapna for the tremendous work that you've done. And I would love to open up the floor if there's anyone who has any specific questions. This is to Sapna and Anaga. They've really gone through so many documentations and interviews, so they're a wealth of information at the moment on what is happening at the country level chapters. If anyone has any questions, please feel free to raise them or put them in the chat. And we will hear from Mina, who is right now in Mina and Moana, who are both leading the country chapter in the TBPPM India from IPH. And then we will hear from Aji, who has been our main consultant within Nigeria. So maybe we move on to hearing from Mina and Aji. And if you have any questions, just put them in the chat. Or I think Sapna and Annika, will you stay for the next 15 minutes with us? Okay, perfect. So thank you so much again for the tremendous work that you've done. We're going to be sharing the executive summary widely. The full report will be available as well on our network, so any members will have access to it. And we'll be sending a news post out in the upcoming days so that you can have access to the full report and everything that you'd like to follow up on. So with that, I'm really happy to introduce Meena Puttaraj, who is the lead of the TBPPM India in IPH. Meena, I would like to give you the floor. Maybe you can say a few words about yourself and then take away where we are with the India chapter.
Thank you, Petra. Thank you so much for this opportunity. Am I audible?
Yeah.
Yeah. Just give me a moment to share the slides. Are the slides visible? Petra?
They are, Mohana.
Yes,
Meena,
yes,
sorry.
perfect.
Yeah.
They're perfect.
Yeah.
Okay, great. And thanks again for this opportunity. I am Meena. I'm from the Institute of Public Health. In short, we call IPH. IPH Bengaluru is the secretariat for the TBPPM Learning Network India chapter. So the secretariat for this India chapter was established last year in November, but actually the manpower for the secretariat was recruited in the month of February or March, around March 2024. So the year 2024 has been very eventful for India chapter, I would say. So along with me, we have Dr. Mohana, who is the community manager. So the secretariat is currently run by two people. One is me and the other person is Dr. Mohana. So in 2024, mainly what we did was that we organized advisory board meetings. Mainly, at least two advisory board meetings we have organized. The purpose is to keep the advisory board members updated about the activities of the network, and also to strategically think about the sustainability of the TBPPM Learning Network India chapter. So we have a very vibrant and enthusiastic advisory board members, which is a great value addition for the India chapter. And in the India chapter, we kind of developed two webinar series. One is the webinar series called Virtual Roadshow Series, where we try to organize webinars highlighting successful TBPPM models that have the potential for scaling up in different parts of India. So that is one webinar series. So here in these webinars, we try to bring different stakeholders, both not just from the private, but also from the public, so that there is some cross learning and cross dialogue is happening. So accordingly, we have organized these webinars. The formats of these webinars are also not, it's not cut in stone. Like, we keep changing the formats in order to promote interaction with the audience and to be a little creative in the way we deliver these seminars. So in this regard, we have organized three roadshow series. And then the other webinar series, what we have launched in the learning network is Let's Talk TBPPM. So the previous webinar series on virtual roadshows is mainly highlighting TBPPM models that have the potential for scaling up, but then that is not really giving us the opportunity to think or have a dialogue on other aspects of TBPPM. So with that purpose, we launched this Let's Talk TBPPM webinar series where we try to talk all aspects of TBPPM, even the landscape, how it evolved in Indian country, and what is the way forward, and what are the challenges we are facing in the TBPPM landscape and all that. So this is a very successful one, I would say, because we actually have more participation from the audience. The discussions are very engaging in these seminars, in these webinars. So we have organized 3 such webinars under the Let's Talk TBPPM series. And then most importantly, apart from knowledge exchange and facilitating knowledge sharing among the stakeholders, the other important core work of the India chapter is to build the capacity of various stakeholders. And here we of August for the TB Survivors Network. As you all know, in India, we have a very strong PPSA program, Patient Provider Support Agency program, which is run by the government. But then not many NGOs are taking up this PPSA program. So we want to really sensitize and orient the new NGOs to take up, to get engaged in the PPSA program. So with this aim, we organized a 2-day workshop, in-person workshop, which was really appreciated. Followed by the workshop, we also had a field visit where we took the new NGOs to interact with the NGOs who are into the PPSA business. So they got first-hand information and experience what it means to engage in PPSA program and what are the challenges in that domain. Other important thing was that myself and Mohana, we were able to participate in 2 important international conference. One is the Health System Research Conference that happened in Nagasaki, Japan. And the other one is the World Conference on Lung Health, where we also put up a TBPPM stall. The purpose of participating in these conferences is to promote visibility for the work we do in the TBPPM Learning Network India chapter. And I was able to share, drawing on the experiences from private sector engagement in the TB work. I was able to share to a larger health system research audience, and that was also an opportunity to promote our work. And the other conference, which was chaired by Mohana, Dr. Mohana, we were able to put up an abstract together with the members of the network, and that was accepted, and that was presented in the Community Connect session in the World Conference on Lung Health. So that really shows how, as members of the network, they can come together, they can organize themselves, coordinate, and then do such presentations and representations in those conferences as part of the network. And apart from this, we also onboarded 2 new members, community representatives in the advisory board. And then we are also reaching out to sustainability is a big issue, and we are seriously thinking about it. In this regard, we are also gathering inputs and ideas, and also active collaboration from the advisory board members. In this regard, we have conducted multiple meetings and follow-up meetings with these advisory board members in this year. So the key achievements, I can summarize and say that the membership has grown from 600 to more than 700 now, because we have reached out to new stakeholders and new members to join the network. The other focus area, as you noticed, it is capacity building and knowledge sharing. So in that front, in those fronts, we were able to achieve. And then strategically also, we have collaborated, we have initiated collaboration and partnership with Indian Association for Preventive and Social Medicine, where a lot of academicians who are interested to engage in TB related work. So that will really help the PPSA agencies in collaborating with the PPSA agencies and supporting them and mentoring them in developing knowledge products, because they have huge data, but they really need academic support to analyze and then develop knowledge products concerning TBPPM work. So that way they can also contribute to strengthen the evidence base for TBPPM. We have also published quarterly newsletters and updates. So we really want our community members to be updated about our network and be active in our network. And the other important achievement of the India chapter is that we have submitted proposals. As you heard from Anaga and Sapna, we are also actively thinking about how to mobilize funds to sustain the India chapter network. So in that regard, we have developed proposals that are in alignment with the vision and mission of the network. So we have submitted to TIFA Bharat, which is a kind of agreement between USAID and the Central TB Division. So the results are not yet out. So we are fingers crossed. And the other important development in the network is that we are actively thinking about forming research teams in within the secretariat. If you see the secretariat for the India chapter, it is Institute of Public Health, which is a research organization very active in the health system research space. We have formed core research teams. We conducted an ideation workshop where many researchers within IPH, they were able to come together and identify, brainstorm on potential research ideas that can be developed into proposals. So they have formed two teams, two big teams, which will work on two proposals, potentially targeting funding agencies like Indian Council for Medical Research and other potential funders to support TBPPM related work. So in the name of research, we can also continue the work network, that is, which is knowledge sharing and capacity building, achievements of the India chapter, and especially about the proposed initiatives beyond 2025, because the funding from the global TBPPM ends in June. So we really want to strategically think about, and we are putting a lot of efforts in sustaining this network. Thank you very much for this opportunity again, and I'm willing to take any questions that you have.
Well done, Meena. Fantastic presentation. And if I think about that, you really only started in spring within IPH to take on this learning network. You've really embedded it within the organization and taken on fantastic work over the last several months. So congratulations to Meena and Moana for, all the work that you do. And if any questions, please raise your hands. We would love to hear from you if you have any questions or any comments. And in the meantime, I'm asking Ajit to bring us to Nigeria. And I know Nigeria right now is very busy with a big board meeting from Stop TB and a national TB conference. So Ajit, thank you so much for pulling yourself out of those meetings, and maybe give us a brief update on how things are, and specifically on the TBPPM chapter within Nigeria.
All right, thanks, Petra.
Ajit, you're muted. Ajit, we can't hear you. You are muted. Ajit, are you with us? I can see her name. I heard her for a second. Can anyone else? No, right? We're not hearing her. Okay. Ajit?
Yeah, so can you hear me now?
Yes, go ahead.
Sorry about that. It took me a while to unmute myself. I was just looking for the button. All right, thanks everyone. My name is Ajia Kirin, as Petra mentioned, and I lead the Nigeria chapter of the TBPPM Learning Network. So I'm going to be giving a brief update. I'll be giving verbal updates. Sorry, I do not have slides. But 2024 has focused for us on basically building progress on the work that we started in previous years, as well as looking at sustainability for the learning network going forward in terms of funding and in terms of just basically transitioning beyond the current funding stream that the learning network has. So some of the work that we've been trying to extend from previous years is, as has already been mentioned by the reviewers, the consultants who did the review of the country chapters, Nigeria is the learning network in Nigeria is very well embedded within the national TB program and the PPM activities that are already taking place in the country. And so most of the work that we have on our work plan really is working in collaboration with all the other PPM implementers and the national TB program, the PPM steering committee, and just basically trying to advance what the country needs as far as PPM is concerned. So I'll give you some of the examples of some of the things that we've been doing in collaboration with these other partners. So one area obviously is to continue with the learning opportunities, making sure that we're having webinars as frequently as we can, and fostering that whole community of practice and ensuring that people are talking to each other and learning from each other. That was one of the big gaps that we had identified before the Learning Network was established within Nigeria, and that's one, I think, one of the major add-ons that most of the partners are happy to be able to collaborate with us on. So those have continued. Usually we do it with the National TB program, with the other PPM implementers. They speak, and then we just basically share information across board, across all the different states. Another important work that has been a highlight of the work that we've done this year is to support the National TB program to establish steering committees at the subnational level. So we have a national PPM steering committee. It's supposed to meet quarterly. It doesn't always get to meet quarterly, but at least we have that engagement happening. And then when we have our webinars and all our other learning engagements, usually we draw people in from the state level as well, because we have PPM actually being implemented at the state level. But each state wasn't necessarily operating within any kind of community of practice or any kind of structure that sort of was promoting PPM at the state level. So this year we supported the national program to just basically build the capacity. First of all, the national program established focal persons in each of the states. We have 37 in Nigeria. So they basically appointed people to be the focal persons for PPM in each state. And then we supported to just basically create virtual learning opportunities to be able to build the capacity. These focal persons. One by one, states are inaugurating PPM steering committee at the state level. So hopefully that should happened in previous years, where the PPM steering committee facilitated a connection between the national TB program and Outer NEPAD for private sector engagement, and they had attended a meeting in Kenya to talk about private sector engagement as a whole. So since then, it sort of stimulated the Nigeria team to want to extend this private sector engagement beyond what is currently happening. How best can we engage the private sector beyond what we're currently doing as our PPM at its highest level? And then beyond PPM, what else can we do as far as private sector is concerned? So we provided support this year to just basically explore that a bit more and just extend just the reach of what the TB program can potentially do with the private sector. What are the potential opportunities? What are other programs beyond TB doing? What is TB doing in other countries as well? And are there opportunities for further engagement that are not being leveraged by the TB program? So we've given them recommendations, and hopefully that should lead to a deeper engagement going forward. Beyond just the work that we've been supporting and providing, just basically doing going forward, we're also looking, as I mentioned, at sustainability. And so we started to engage different partners on the possibility of transitioning the role of the steering committee, of the Nigeria PPM Learning Network chapter, so that it can sort of go on beyond the current funding stream that is available to it. And the good news is that we've gotten quite a bit of interest And I think that's a testament to the value that the community sees on what it is that the Learning Network has done so far. And so we have quite a bit of interest in sort of taking on the role or continuing in the work that is being done. So right now we're having talks with at least 3 different organizations, and we haven't necessarily concluded on what's like the specific, like the details of what the structure is going to be going forward. But we're confident we can come up with something that, allows a lot of the work, or pretty much all the work that we're doing, to not just continue, but even get extended and to continue to receive funding from the Global Fund, from USAID, from Stop TB. So that's exciting news for us. The plan is to conclude on what the structure will look like. Are we sort of pulling all these resources together, or are we just going to find one organization to take on everything? And then we'll spend the next 6 months just basically transitioning and just helping the new structure to sort of stand, so that by the time that the current funding is concluded, we also have a really, really strong force for how to continue going forward. So that's pretty much in a nutshell what we've been doing so far and what we're hoping to do before the year comes to an end. Yeah. So thank you very much for listening, and I'm happy to answer any questions you have.
Thank you, Aji. Thank you so much. Thank you for being there and for representing the voice of PPM within Nigeria and pulling people together. Fantastic job. So really appreciate you taking the time out of the busy schedules to be here with us. Thank you so much. I would now like to, I know that there's several countries that are really interested in doing a lot of great work on PPM, and one of those countries is Indonesia, and I'm very happy that Aditya is here. Aditya, would you like to say a few quick words about the work on PPM in Indonesia? And go ahead.
Thank you, Petra. Am I audible to you?
Yeah.
Okay, sure. Thank you, Petra, and hello, everyone. Good evening from Indonesia. I'm Aditya, PPM advisor from the USAID LIP Indonesia, currently working with the NDP Indonesia in the PPM national team. So thank you for having me. So this is kind of different with the India and Nigeria, that in Indonesia we don't have, currently we don't have an active PPM country chapter yet. However, we have more than like 225 PPM officers working in the fields. And these PPM officers were managed by the national PPM team. And with the support from the USAID TB private sector, they are also senior program officer who assist these PPM officers to conduct and monitor the PPM activities. So we usually share the practice and other the PPM related information in our WhatsApp group. It's not using the TBPPM Learning Platform Network. And this kind of information was shared in this kind of WhatsApp group. So we are more active, not in the platform, not the online platform, but rather than in the WhatsApp group platform. So in terms of the PPM achievement in Indonesia, actually we achieved some kind of huge achievement this year. So last year, Indonesia achieved the highest ever TB case notification in history with more than 820,000 TB cases reported. And by November 2024, we already notified 785,000 TB cases. So we are optimistic to reach more than 900,000 TB cases this year. And the TB public-private mix approach significantly contributes to this rise in case notification, because compared to 2022, the TB case notification from private providers has increased tripled, which accounted for 251,000 TB cases. And especially in the private primary care, it is increased 5 times higher than 2022, with contributing for the 15,700 TB cases. And one of the major achievement of the PPM practice in Indonesia this year, we successfully conduct the pilot of TB Innovative Findings Initiative in collaboration with the other partners such as the USAID, Global Fund, and then the World Bank, which empowered primary care, especially the primary private providers to improve the quality of TB care at the facility. And also, we conducted the second TB inventory study this year because we have the previous inventory study in 2017. And with this year result, it is resulted that there is a 25% reduction of underreporting TB cases at national level. And the greater reduction happened in the private clinic and GPs, which accounted for 9.700 reduction of underreporting TB cases. So this kind of result has showed us that the importance of the PPM practice in our country. So in that conclusion that this PPM practice is still continued next year. Moreover, the new president of Indonesia has prioritized TB as the quick win agenda in his first year. So the PPM plays important roles to ensure that all healthcare facilities are engaged in TB case finding, and the TB patient can receive an effective treatment in all of healthcare facilities. So they are for me, Petra. Thank you.
Fantastic achievements. Thank you so much, Aditya, for sharing. Really, Indonesia is making such massive strides, and we're so happy that to hear those incredible achievements. And thank you for sharing them with us. Really well done. So with us also is Tile, and I know you're doing work in Ethiopia, and we would love to hear from you as well.
Okay, hello, can you hear me?
Yes, loud and clear.
Okay, thank you. So my name is Tulaye. I'm from Ethiopia. I work for the USAID Eliminate TB project as a senior PPM advisor. So at national level in Ethiopia, we have like 1,200 private facilities which are involved in TB program out of the 12,000, which means like we have engaged only the 10% of the total private facilities. So to mention some of the PPM achievements in 2024, we have successfully engaged about 200 new private facilities to the program. Previously, we used to engage only, like the higher level private facilities, but this year we successfully engaged the pharmacies and lower level, the primary clinics, so that we could see their potential, especially referring the presumptive TB cases. The other achievement is for the response of improving TB diagnosis in private facilities. We advocated in placing the gene expert machine in private facilities. So we successfully achieved that, and now in this year, like we have a total of 37 private facilities have their gene expert machine, and they are delivering the service. So these machines are provided by the Ministry of Health in collaboration with USAID. The other important initiative is this year we have started to provide TB preventive treatment in private facilities. In previous years, there wasn't any TPT medication in private facilities, but this year we have started doing that. And as well, successfully, we have reached about more than 800 private practitioners actually through different capacity building initiatives like different basic TB HIV trainings, and different especially the TB clinical seminars, especially for the higher physicians, because they cannot attend the whole course of the basic TB HIV training. So we produced a protocol of 1 day TB HIV training for the higher level physicians and senior physicians, so that they can, most of the cases they go to them to the higher level, the physicians and senior physicians. But if they don't know where are like the gene experts in the city, so that just introducing this way, we have successfully reached more than 800 private practitioners. So previously at country level, only PPM contribution was taken as indicator to monitor PPM program. But now we have started to monitor TPT in private facilities, HIV testing of TB patients of private facilities, access of private facilities for gene expert testing, and even percent of the specimen referral from the private sector. So this way we have progressed this year. And as well, this year we have successfully conducted the PPM specific country level review meetings and forums. In previous year, like, you know, the review meetings and forums were like in like it's in combination with the public facilities. So the issue of the private sector, you know, it's annexed. Most of the time they, you know, they are discussed at the end of the session. And so this year, like, we have successfully done that. And the other important is like we are developing the TB referral, the TB service referral directory, which consists the list of all the private facilities, and as well actually the list of all the public facilities, so that the private practitioners knows where to refer the cases. So as an opportunity for in 2025, to mention some of the opportunities in 2025 for the PPM program. Now we are going to revise the current PPM TB implementation guideline, which was last revised in 2018. So this is a very good opportunity for us, like to include some of the updates in the PPM implementation guides, and to take the advantage of mentioning or some of the challenges of PPM program. The other thing is like more partners and projects are coming indeed, like in 2025. We anticipate more projects and partners to come in 2025, so that we can have more advocates for PPM, and as well more people for the national technical working group, so that on the way we can have like more resources for the PPM TB program. Thank you, Petra.
Well done. That sounds like an enormous investment in PPM infrastructure that you're building, Tile. And I'm really looking forward to hearing what type of outcomes that will show us, because obviously when you're putting all these efforts into training people and giving them the equipment, it has to result. So looking forward to seeing the results from Ethiopia that will really help the people with TB. Thank you. So I love hearing all these stories, and I know that it's great that we're sharing all of this. I see many people. I would love to hear from all of you. So maybe to give us a chance, and I know that many of you will, I will give you a chance to say something, but to bring us all on one page, I would like for Moana to maybe share right now a Menti code, so that we can put our thoughts together in one platform. Moana, do you want to take over from me for a few minutes? Moana works in the India team in IPH. Moana, please.
Yeah, thank you. Thank you, Petra. Hi, everyone. Good evening. So we will reflect on our progress in 2024 and share our thoughts here and the learnings and the future ahead. So we have set up this session structured using Mentimeter. We will get a live inputs. So we encourage you to participate. So I'll share the screen. You can scan the QR code here. Is it visible?
Yeah, I can see it.
Yeah, just scan this QR code. If not, you can browser, you can enter menti.com and use this code to enter. Either you can use your browser or you can scan through your smartphone the QR code. And take a moment. So you're able to log in?
Yes.
Yeah. So we'll begin with our first question, which focuses on observing our achievements. What new projects or partnerships in PPM have been particularly impactful in your country or organization this year? Please take a moment to answer this question. I think everybody were able to log in to the Mentimeter. As you type, you can think about the initiatives that have driven meaningful change, expanded the TB care access, or strengthened the collaborations. You can think about that and type in your responses. Okay, thank you. Thank you all for sharing your insights. It's great to see such a variety of perspectives and experiences you've shared here. I think everybody have answered. Definitely, we will collect all the responses. After that, we will work on that, summarize that, and we'll try to implement it. We'll move on to the next question. This is the second question. Let's focus on the TBPPM network itself, the second question. So how has the network supported your work or your learning about PPM? And what additional support would you like to see in 2025? How could we improve that? That is how we have framed this question. You can answer this using the same QR code. So as a network, we are always looking for ways to improve and ensure that the network serves your needs effectively. So share your honest feedback. It's very invaluable to us. Okay, thank you. Thank you for sharing how this network has supported your work. Your feedback is really very insightful for us. And we work on incorporating these suggestions also to make it better. Should I go on to the next one or will I give a break?
Yeah, let's do one more and then we'll, let's do one more.
Yeah, sure. So the third question is about what are the PPM priorities in 2025? So building on our learning, let's talk about the future. What do you think should be the key priorities for PPM in 2025? So you can consider areas like policy support or capacity building, technology, community engagement. What are your priorities? Just let us know.
Much. Great input. And Moana, thank you so much for leading this. This is really useful, and all your points are really well taken. Very much appreciated. So I know we have several people that I would love to hear from. So if I can ask Vivian, I thank you for joining us, Vivian. Do you want to unmute yourself and maybe put your screen on and talk for a few minutes?
Yes, sure, Petra.
Thank you. Go for it.
Yeah, so hi everyone. Good morning, good evening, good afternoon, depending on where you're coming from. My name is Vivian, just as Petra has shared. And I just wanted to share some of the activities as young people from Kenya have been doing in terms of TB and TBPPM. So I'll just start with the current one that is currently going on. There's an activity we did back then in Swahili, we said it's Tubonge TB Kwanganya, to mean that let's talk TB in our public service vehicles, whereby most of the TB cases are normally transmitted. And towards that, we really got good outcomes towards that, and we got some positive cases. And towards that, we also talked to the organizers of the PSVs, that is the public service vehicles, and they agreed to involve us to their award-winning activity that is happening actually today. And we are there currently doing sensitizations to the conductors, to the drivers who are there. We are just trying to sensitize them on issues concerning TB. And I believe that was a plus for us when it came to the private sector for us as young people. And I believe that maybe with time we'll be able to keep up the fire burning with them. We won't lose track. And another activity that we are currently working on, but it's not it hasn't borne so many fruits yet because of maybe lack of resources, but it's the neural projects we've been doing there, like it's the talking walls. Let me just say the talking walls, whereby we have in the community, in our hoods, we have some walls that are just neglected, but people are staying there within the hood. We get to paint them, but we paint them with messages or even pictures that show and pass messages that, when you have these signs or a picture of somebody coughing, this is what you need to do. These are the etiquettes of when one is coughing. So we've been doing that. And we are thinking of as well of involving the pharmacies, the faith-based organizations. Maybe we could bring them on board, whereby we just go to the churches, talk to people, bring the young people leaders, then bring other young people, so that we can have a conversation whereby it is not the mythical aspect of TB is the one that is running within our communities, but as well the right way of it and how maybe we can mitigate TB with time. And as well on the talking walls, we were thinking of involving the church. There are some churches that have the facilities, the private facilities for the churches. We were thinking of maybe painting the walls, but it's still ongoing. It is not a positive yet. I can't say it's positive yet. We're still waiting for feedback from the NCCK, the National Churches of Kenya. When it goes through, I'll let you know, Petra, as well. And I'm really crossing my hands so that it goes through. And as well, we are, since it's December and most of the people are closing, most of the institutions are closing. Currently, around last week, but one, we were having some engagements when it comes to the both public and private institutions, whereby we thought that since they normally have the culture week, why not us as young people take the information to them before they go back to their respective counties or homes? So we did the screening at the institutions, both public and private. We talked to them. They had these dramas of whereby I directed one, but it was talking on TB. So it was played there and people enjoyed. People came for screening. Some turned out to be positive, but apparently now we are looking as well at how are they being linked to the facilities wherever they are going to. Remember, they are closing schools. So wherever they are going to, we have to link them or even refer them to the nearest or the place they feel they are comfortable with. And as well, we are trying to integrate the peer support groups led by the young people, both the public and the private sector. That is where now we get to engage with them and see, or maybe what are the kind of challenges they go, or what are the gaps the private sector has, or what are the gaps that the public has. How can we bring these gaps together and look for a positive solution for them to be engaging in? And as well, there's one ongoing conversation, but maybe by next year, God willingly, it will be true. We are trying to engage the corporate world in terms
Great.
of maybe having the sports events, because Kenya, we are really known when it comes to TB, really like engaging the sports sector, so that a lot of people will come, because that is the main event that people love in Kenya. So we are trying to look for how we can engage the young people when it comes to the corporate world in terms of maybe making them aware of TB. Why I'm saying this is because I had a client who had TB. Apparently, she happened to work in the bank sector. She was really stigmatized because of that. And it turned out like she told me, Vivian, why don't you just come back and just come out and talk to my people in the bank? Just tell them, tell them TB is curable, tell them everything. And I said, okay. I wrote an email. They never responded back. So I just felt, okay, let me look for other avenues whereby I could bring the corporate world together and maybe just sensitize them and let them know that this is what happens. TB is not like a death sentence or something else. So
Well
yes,
done,
those are some of
Vivian.
the things that we have been doing as young people. And yes, I'm looking forward to TBPPM Learning Network engaging the young people across Kenya and across the globe. Thank you so much,
Happy
Petra.
to. So nice to hear. There's so much energy in Kenya and so many great plans. And I know that the youth movement is really strong in very many countries. So if there's other countries that are interested in collaborating, Vivian and Madhu Sadan, they're doing a fantastic movement with the youth movement. So thank you so much. We have only 10 minutes left, and I have two really important things that I would like to still bring forward. And I would love to hear from Prachi and Lisa, because both of you are doing amazing work that I would like to be highlighted in this forum. So Prachi, if you can do a short 2 minutes, and Lisa, if you can follow it a short 2 minutes, that would be amazing.
Hi everyone. Yeah, 2 minutes is a tough job, but yes, we will be undertaking a study in collaboration with McGill University, the Research Institute of McGill University, and World Health Partners in Delhi. And as everyone on this call knows, that we have been talking about the private sector, and especially in India, a considerable portion of primary care services is done and provided by the private sector players. And private sector here, I'm not just talking about the formally qualified, but there are informal providers also who contribute to a lot of primary care. And now we've also seen within our projects and outside, there's a lot of evidence that they also contribute significantly in tuberculosis care. So this study or the project is very, very novel, where we will be engaging with these informal providers, providing them with training support. And it's basically using tongue swab. And this is particularly very important study, and very new also. I think I don't know if there's anyone who's doing it, but it employs the tongue swab method, which is a very simple diagnostic approach suitable for these minimally trained health workers like the informal providers. And this trial that we will be conducting will also test an innovative approach to TB case finding. It's actually going to address the diagnostic gap by equipping these IPs with the skills to collect tongue swabs from individuals suspected of having TB within their communities. So I think this will be one of its first kind of study that we will be conducting, and starting 2025 January, because it's gone for the ethical approval and it's in the last and final stages of getting the approval through. And meanwhile, we are also working out on the team and everything. But I'll keep you posted if people are interested in knowing the results and what's happening with it. But we are fully geared to launch this using tongue swabs. I think I finished within 2 minutes, or maybe a little.
Thank you. No, Prachi, hugely important. It's so fantastic to see you doing this work, because these tongue swabs are going to be a point of care test that is not just for the informal providers that you're looking at, but really also any other if it works, this is something where it could be by drug sellers, by pharmacists. So hugely important strengthening of the primary healthcare outreach and private providers. So thank you for doing the work, and looking forward to hearing more in 2025 about all the outcomes and intermediate outcomes. Thank you. And Lisa, do you want to just take the floor for a minute?
Yeah, I can try. I can keep it under 2. Yeah, thank you so much. Yeah, it's fantastic to hear all the great work going on. I don't join this that often because it's usually in the evening and late in Far Eastern Asia. So great, but I just want to kind of put a plug in. I work for FHI 360. I think a lot of you know us. Aditya mentioned our project in Indonesia and TBPS. But we're just starting up a new global award called Grad TB, which is all focused on drug-resistant TB. And there's PPM components. So it focuses on 24 USAID priority countries, and most of the PPM priority countries are also within that list. Probably know who you are. It also covers another 31 countries that get Global Fund TA for TB. So it's 50-something countries. So pretty much everybody on the call, your country is somehow on the list. And the first objective is to strengthen local systems, including the private sector, related all to drug-resistant TB. But we can kind of go further than drug-resistant TB too. But we're very excited to really try to get drug-resistant TB services in the private sector. I think we've heard even at the PPM CoreGroup from some of the great work going on in India, but it's pretty small, localized, where you can actually get DRTB, the correct testing, the correct medicines, the extra support that's needed, all within the private sector. So it's a big, important part of this project. And what if the country's interested, you work through the USAID mission there. And the National TB Program, and then they request from the Washington group, where the people that are actually managing the award sits, and then they'll come to FHI 360. We work with Partners in Health. We work with TAG, who you all know really well, VIAMO, and IRD are the main partners on this. So I'm just super excited to have a new opportunity to really get to strengthen private sector, specifically drug-resistant TB work. Thanks, Petra.
Thank you so much, Lisa. And we will happily distribute this opportunity very widely within our network and collaborate closely with you, Lisa, and with FHI to make sure that everyone gets the opportunity. Because as you say, you know, this DRTB services, to be having them available in the private sector is going to be even more important. So thank you so much for the fantastic work that you do with many partners around the world. So today, since we're listening to so many wonderful project works in country, partners that are doing fantastic work, I'm also happy to celebrate 2 people that have done a great job in interacting with our network. And this is something that you hear the activities and the outcomes immediately in of the activities on TB, but I think we want to celebrate today Umer and Tianpam, who both have been really, really active in our website. They've both been part of the TBPPM course, and just to put a little celebration around both of them and congratulating them for being so active in our learning network platform. So if you all could turn on your cameras, we would love to take a picture and do a quick celebration and give Umer and Tianpam a quick chance to say a word. Umer, do you want to go start?
Yeah, first of all, good morning, good evening, good afternoon to everyone. I am truly honored and humbled to be the name of the winner of this contest. And this is just not only mine, but everyone who belongs and who supported me. This is for all. So thank you so very much for all this. Thank you.
Fantastic. Well done and so great. I'm glad that the network is useful. And Tianpam, do you want to say a few words?
Yeah. Good morning, good afternoon, and good evening, everyone. So I'm deeply honored and excited to become one of the active members of the TBPPM Learning Network. And maybe it's allowed to me to briefly introduce myself. I work as a PPM program manager at the Friends for International Tuberculosis Relief in Vietnam, and have been a part of this network through the TBPPM course since 2022, and really interesting the many presentation and discussion about the TBPPM work. So actually, because we have no more time, so I just want to look forward to more opportunity to interact with many of you here and share insights about our projects in Vietnam in the next year and learn from you. Once again, just thanks Petra for giving me a chance to speak today, and it's a pleasure to meet you all. Yeah, over.
Really great. Thank you so much for interacting with the platform, and it's always wonderful to see new faces come to present and to hear from you. So glad that you are an active member. And with that, we're at the end of our forum, our town hall of today. I would love to let you know that today officially we are launching the photo contest that is going to lead us into World TB Day. And the photo contest is, I heard Vivian say all these wonderful pictures that you're taking. I know Rabia, I know in Tanzania, you're taking amazing pictures. So, and similarly from Indonesia, I've seen many good pictures. Brack, you have the most beautiful pictures for Hannah. So I would love to encourage you all to, Mercy Corps has won several times. So Umar, you too. I would love to for you to share this opportunity of taking pictures of people that are doing the work on engaging the private providers that are supporting patients. Take some pictures of your work so that we can really distribute it widely and show the rest of the world, help you with awareness raising and advocacy. So the photo contest is in the chat. I'm just showing you the poster. We will actively distributed widely. You have the chance until February 13th to take pictures and submit them to the Learning Network. Please put this out widely. It can be any quality. Of course, the better the quality, the better the picture. But we would love to showcase your work. So with that, I would like to close today's meeting. It's such a great opportunity to see so many members together, to hear of your fantastic work. I really appreciate all of you taking your time to join and to share your work. We're looking forward to many webinars and many opportunities of engagement in 2025. If you have specific thoughts, I know you shared a lot today. We will definitely take those into account. Feel free to reach out to us anytime. We love your feedback, and we're happy to work with you on an individual basis to also collaborate with the projects that you're doing at country level. So thank you all for being here and looking forward to getting in touch. Wishing you all a wonderful holiday if you're taking one, and see you very soon, I hope. Goodbye, everyone. Happy holidays from the TBPPM Learning Network. See you all soon.
Thank you, everyone.
Thank you. Thank you for joining. Bye.
Bye.
Goodbye. Goodbye. So good to see you, Farhana. Bye, Vivian. Bye, Tian Pam. Thank you.
Same here, Petra. See you again, hopefully.
See you soon. Bye, Tile. Thank you so much.
Ciao, ciao, ciao.
Ciao, ciao.